The mainland could see a rise in people getting reinfected with COVID as Omicron's variants BQ.1 and XBB are detected. This came as some researchers said the latest round of infections has likely peaked in major cities, but rural areas could reach the peak during the Lunar New Year.
Questions have risen over possible reinfection on the mainland after authorities detected Omicron subvariants BQ.1 and XBB in at least 9 provinces. Most of the people infected with the new strain were inbound travelers. The new subvariants have shown greater ability to evade immunity from a previous infection or vaccine and have been circulating in the US and Europe earlier. Responding to concerns of repeat infections, Wang Xingyu, an infectious disease expert at Huashan Hospital of Fudan University, said that it could be possible due to the subvariant's strengthened features. The first dependent factor is how much overlap there is between the newer variants one encounters compared with the current ones of BA.5 and BF.7 strains. Will have stronger protection against reinfection if there are higher overlaps, he said. Adding the second determining factor will be the different antibody levels within individuals, which will gradually drop over a period of time after the first infection, thereby increasing the risk of reinfection. Wang said the new variants, however, do not have a different structure or account for higher death rate. He stressed the importance of vaccination, citing it will lead to milder symptoms. Meanwhile, researchers from Ruijin Hospital of Shanghai Jiaotong University School of Medicine and Shanghai Public Health Clinical Center projected that infections in urban areas of Beijing, Guangzhou, Shanghai, Chongqing have likely peaked at the end of 2022. But provinces of Sichuan, Shanxi, Gansu, Qinghai might hit the peak around mid or late January during the Lunar New Year, especially in rural areas or small cities and towns.
Armed gunmen killed 14 people at a prison in the border city of Ciudad Juarez in northern Mexico. The gunmen opened fire upon arriving at the prison around 7 a.m., killing 10 guards and 4 prisoners. Another 24 inmates managed to escape in the commotion, and 13 others were injured. Authorities suspect the attackers to be members of a drug cartel. Shortly before the attack, police officers came under fire on a street near the prison, but it remains unknown whether the two incidents are linked to each other. The city has witnessed years of violent clashes between rival drug cartels, killing thousands of people in the past decade.